Hello and welcome. Today, we're diving into a really cool piece of medical tech that basically works like an intelligent filter for your own blood. It's called apheresis, and you know what? It's quietly revolutionizing how we treat all sorts of diseases and how we donate life-saving blood components. Let's get into how it all works.
Just think about this for a second. What if you could reach into your bloodstream and just pluck out the bad stuff? Like only the harmful antibodies that are causing a disease. Or on the flip side, what if you, as a healthy donor, could give just the platelets a cancer patient desperately needs and get all the rest of your blood right back? Well, this isn't science fiction. It's the whole idea behind apheresis.
You know, the name itself is a huge clue. Apheresis comes from a Greek word that literally means to take away or to separate, and that's exactly what this amazing procedure does. It's a pretty sophisticated process where blood is drawn out, it's sent through a special machine that sorts it into its basic parts. Plasma, platelets, red and white blood cells, and then, here's the kicker, it returns everything you don't need right back to you.
So, you might be asking, why go through all this trouble? Well, it really boils down to two main goals, and they're super easy to remember: healing and helping.
And this slide really breaks down the two sides of the apheresis coin. On one hand, you've got therapeutic apheresis. Here, the goal is all about treating a patient by physically removing something harmful from their blood. But on the other hand, you've got donor apheresis, which is all about a healthy volunteer giving a specific part of their blood, like platelets, to help someone else. It's the exact same technology, just used for two very different but equally life-saving reasons.
Okay, this all sounds incredibly advanced, right? But how does the machine actually sort the blood with such precision? Turns out it uses a couple of really clever techniques that are based on, believe it or not, some pretty simple physics.
All right, the first and most common method is called centrifugation. The easiest way to picture this is to think of a super high-tech salad spinner, but for blood. As it spins at incredibly high speeds, the different parts of your blood separate out based on their weight or density. The heavier red blood cells get flung to the bottom, the super light plasma floats to the top, and everything else, like platelets, finds a layer somewhere in between. It's just a remarkably efficient way to sort everything.
Now, the second method is filtration. Instead of using weight, this technique separates everything by size. The blood gets passed through this special filter that has microscopic holes in it. And these pores are perfectly sized to let smaller things, like plasma, pass right through, while holding back the bigger stuff, like your blood cells. It's like an incredibly specific sieve. Some of the newest machines even use a combination of both of these techniques.
Now listen, none of this, the spinning, the filtering, none of it would work without one secret ingredient, an anticoagulant. You see, the second blood leaves your body, it wants to clot. That's its job. To stop that from happening inside the machine's tubes and filters, a substance like sodium citrate gets mixed in. It keeps the blood flowing nice and smooth through the whole process.
Okay, let's walk through it. Let's follow your blood on its little journey. First, blood is drawn from a vein, usually in one arm. Right away, it goes into the apheresis machine, and that all-important anticoagulant is added. Then the machine does its magic, separating everything out. The specific part that's needed, whether it's harmful plasma being removed or healthy platelets being collected, goes into its own sterile bag. And finally, all the other parts of your blood are safely returned to you, a lot of times through a line in your other arm. So we've covered the how, but what about the who? Who actually uses this technology? The answer is a much wider range of people than you might think, from people with chronic diseases to patients who need very specific transfusions to survive.
And the type of apheresis gets its name from whatever component is being targeted. Makes sense, right? So plasma apheresis is for plasma, thrombocytoapheresis collects platelets, leukoapheresis goes for white blood cells, and so on. There's even a really specialized type called photopheresis, where cells are taken out, treated with UV light, and then put back into the body to help modulate the immune system. Pretty amazing stuff.
I mean, this list right here just shows you how incredibly versatile therapeutic apheresis really is. For autoimmune diseases like lupus or MS, it can literally remove the antibodies that are attacking the body by mistake. It's a game changer in neurology, for all sorts of blood disorders, and it's even used to help stop the body from rejecting a transplanted organ. It's really become a cornerstone therapy in so many different fields of medicine.
And maybe one of the most incredible uses is for stem cell transplants. The apheresis machine can carefully filter out and collect these precious peripheral stem cells right from a donor's bloodstream. These cells, the ones you see right here, can then be given to a patient to literally rebuild their entire blood and immune system from the ground up. It is truly life-saving.
Okay, so let's shift gears a bit. If you or someone you know ever needs apheresis, what's the experience actually like? Let's quickly go over the practical side of things.
So, how long does it take? Well, it really varies. A simple platelet donation might be done in as little as 45 minutes, maybe up to 90. But more complex treatments can take longer, sometimes a couple of hours. And the whole time, the person is usually just resting comfortably in a special chair.
And here's the most important part. While it is a sophisticated medical procedure, you should know that apheresis is considered very, very safe. The overall rate of any kind of complication is extremely low.
Of course, in medicine, everything is classified, so potential complications are grouped by how severe they are. They range from mild to moderate, but I really want to stress that severe or fatal complications are exceptionally rare. You can see the Turkish medical terms here too, which are used in clinical settings.
The side effects people do experience are almost always mild and happen right there during the procedure. Someone might feel a little chilly or start shivering. That citrate anticoagulant and also make your calcium levels dip a bit temporarily, which can cause a tingling feeling, usually around your lips. And, sometimes they can be an issue with the IV line. But these are all things the medical team is watching for very, very closely.
So, if we're going to sum it all up, apheresis is so much more than just a machine. It's a highly precise, highly personalized medical tool. It lets doctors go in with surgical precision, target just one component in the blood, and offer treatments and donation options that were honestly just a dream not that long ago.
And that really leads to one final big question. We're moving deeper and deeper into an era of personalized medicine. As incredible technologies like apheresis get even more advanced, it just makes you wonder, what other secrets are hiding in our bloodstream that we'll be able to unlock next? Thank you so much for joining me.